always tell patients about all the recent new medications that are targeted, that are brilliant, that are helping people, and all the ongoing clinical trials. There's FDA approvals of many new drugs over the last few years and drugs that are on the horizon, which will also be made available. So the good news is that we have so many different options that we don't run out of things to offer people. By very definition, the hypothesis of a clinical trial is that we're improving upon our standard therapies. Some of the things that are on the horizon are immunotherapies. So for example, there are drugs which are called checkpoint inhibitors, and those are extremely interesting drugs that actually act by jump-starting a patient's own immune system to recognize the cancer cells as other. Cancer cells have a way of putting a brake on the immune system so that the immune system can't find them and kill them. But some of these drugs are able to lift that brake on the immune system and unleash a patient's own immune system and to kill the cancer cells that way. The checkpoint inhibitors are already FDA approved for lots of other cancers, for example, lung cancer, melanoma, kidney cancer, and others. Most of the work at this point for the checkpoint inhibitors has been in triple-negative breast cancer because the immunotherapies work best in cancers that are very mutated and very different from normal cells, and triple-negative breast cancer cells are the most mutated compared to other subtypes of breast cancer. So there are trials that have been done in triple-negative breast cancer and ongoing trials combining the checkpoint inhibitors with chemotherapy, but the mainstay of treatment is chemotherapy because we don't have the targeted therapies to different receptors. However, there's tons of clinical trials that are looking at the role of newer biologic or targeted therapies to augment the effectiveness of chemotherapy or even use in lieu of chemotherapy for triple-negative breast cancer is a very important area of research. So it's just a really promising time to have metastatic breast cancer because people can do well for a long time with good quality and quantity of lives.